Can you see my screen now?
I can. It looks good.
Cool. Any here. All right, so this is dental disease in pets and four things we can do to prevent it. I won't
Okay.
I won't spend too much time introducing myself because you know me, but um I am Dr. Keaton, and I have always been passionate about dentistry. I started it in veterinary medicine as a technician. Back in my early 20s, I started out at Fabric Vet in the kennels and kind of worked my way up to becoming a technician and then decided to apply to veterinary school. But it was early on as a technician that I was fortunate to work at a practice that had dental x-ray very early.
Mm.
And a couple technicians that were really passionate about dentistry. So then I went to veterinary school, went to Iowa State, actually planned on doing mixed animal medicine. So I focused a lot on large animal and not on small animal dentistry. Um, but then I got out in practice, did mixed animal for about 18 months before I decided it wasn't for me. And doing mixed animal was difficult to pay my student loans off.
Yep.
So ended up at Norway Veterinary Hospital doing small animal medicine and really honed their dentistry program there. We got dental x-ray and really built the program from the ground up. Got really into dentistry, took a lot of courses, um, and trained under board certified dentists. Um, and then I decided that there was just a huge need in Maine for dentistry. So I started Mainly Veterinary Dentistry as a traveling practice 3.5 years ago, and I was going to other practices to help with dentistry. And then shortly after doing that, decided we really needed a brick and mortar to help as many patients as possible. So 2.5 years ago, we opened in Windham, Maine. Um, and it's been just an amazing journey and really great to help pets with their oral health. So this is the team that we started with on the left. I hired 3 technicians, and then shortly thereafter I hired a CSR. So that's the original team. And now we're up to 10 team members, including we had an associate vet start a few weeks ago. So still keeping our wait times down so we can get patients in. We work pretty efficiently so that we can have low wait times. So usually just 2 or 3 weeks booking out, so not too bad. But we've grown really quickly, which has been an awesome thing to see.
Good.
This is our dental suite. So we have 4 tables now. This is our 2-table setup. So now we're up to 4 tables in our dental suite. We have dental x-ray for each table, great monitoring system, and great space to get dentistry done. So this chat is going to talk about how to prevent dentistry, but first we're going to how to prevent periodontal disease, but first we're going to define the problem. So 70% of cats and 80% of dogs over the age of 3 have some level of dental disease. So majority of our patients, our pets, have dental disease. And so it's really important that we diagnose it and address it if we want to prevent significant problems. So first question is, how is this possible? A lot of people are surprised when they hear that 70–80% of pets have dental disease because it's just not something that's been talked about a lot. It's been something that we've missed the boat on as far as preventing disease for a long time, but we're trying to get better about it. So how is this possible? If you think about our teeth and what we do to keep them healthy, dog and cat teeth are very similar. They have some important differences, but they're prone to many of the same problems that our teeth are prone to. And so if you think about what we do, we brush our teeth 2 or 3 times a day. We get our teeth cleaned every 3 to 6 months to prevent disease. And so their teeth really are no different than ours in that respect, that if we want to maintain their oral health, we need to do some similar things that we do for people. So that's one aspect of it. So So let's talk about what is periodontal disease. So periodontal disease is infection and inflammation surrounding the tooth. So stage 1 periodontal disease is gingivitis, so inflammation of the gum line. And what happens is we get a buildup of biofilm. So we get a biofilm buildup that changes the bacterial environment in the mouth. And the body then reacts to that biofilm change and incites an inflammatory response. So the gingivitis, the red gums, the periodontal disease itself is the body creating an inflammatory response in response to bacteria. So stage 1 is gingivitis. And again, if you think about what we do, we brush our teeth every day because we're removing that biofilm and plaque before it becomes calcified tartar. So plaque is the stuff you feel in your teeth when you wake up in the morning, and you can brush that off. But after 24 to 48 hours, it becomes tartar. And so that's like the brown stuff on this dog's teeth here is tartar calculus, which you really can't brush off. And so that's why it's important to brush every day to remove that biofilm and plaque that eventually can change the bacterial environment in our mouth and create inflammation. So stage 1 is gingivitis. This is the stage where things are reversible. So we haven't had significant changes underneath the gum line around the tooth, like bone loss. And if we start brushing and do regular cleanings, then we can reverse this and get back on the right track. Then we progress from gingivitis to stage 2 to 4 dental disease. So that's where we start to lose the connective tissue that surrounds the tooth, it holds the tooth in place. And so we get gingival recession. So the gum line, like on this upper big tooth here in the picture, the gum line starts to recess away from the tooth. And so that we lose that connective tissue. The reason why that gum line is recessing away from the tooth is because we've also lost bone, the bone that surrounds the roots on that tooth. And as that happens, we get infection deeper and deeper around the tooth, and it's very hard to get all of that out of there and reverse it at this point. And we really can't get that bone back in most cases. So once we get to stage 2 to 4, that's irreversible. Certainly we can do things to treat it, which oftentimes involves removing teeth so that we can get the infection completely out of that socket. But we can't get rid of or reverse this in the fact that we have to remove teeth at this point to treat it. So that's why it's important, if we want to prevent the mouth from getting to this stage and prevent periodontal disease, we need to treat it early. So this is the irreversible stage of dental disease. Other problems that pets can get, less common, but more common in people, is cavities or caries lesions. So pets have a few molars way in the back that are shaped more like our teeth. So our teeth are shaped differently because we crush our food. And so a lot of our teeth have a flatter surface with grooves in them that trap bacteria, and then the enamel gets eaten away and we get cavities. Dogs have a few teeth way in the back, 2 on the top and 3 on the bottom, that do have that flatter surface that can get infected. So it can happen, but the other reason it doesn't happen as commonly in pets is, generally speaking, they don't eat sugar. So we get cavities too because we like to eat sugar, and that increases risk for cavities. So we generally see these. If we do see cavities in dogs, it's usually because people are feeding them a lot of ice cream or carrots. Like a lot of carrots are okay, but a lot of carrots or sweet potatoes can increase the risk for cavities. In cats, instead of cavities, we see tooth resorption. So really common in cats, tooth resorption. It's always kind of top of the mind when we see lesions on teeth or gingivitis on teeth in cats. Tooth resorption is when the body starts to resorb or eat away at the teeth. And we don't know why cats are so prone to this genetically. But it happens. It can happen at a really young age in cats. Tooth resorption also happens in dogs, more commonly found in older dogs, but can also happen in the roots of younger dogs, especially dogs that chew a lot of hard things. I think just all of that impact to the teeth causes some changes to start the roots to become resorbed. But in cats, again, it's really common. And unfortunately, once tooth resorption starts, we have no way at this point to prevent it or keep it from progressing. So the tooth has to be extracted because it becomes very painful. Once it affects the crown, we lose the enamel of the tooth, and then infection can get inside of the tooth and cause infection and pain. And these teeth are very painful. So once we diagnose tooth resorption that's affecting the crown of the tooth has to be extracted. So that brings me to the question of, so what if we do nothing? You know, a lot of our pets, you know, back a long time ago before we diagnosed these things, lived with this, and you know, some of them did okay and others maybe didn't, and we didn't know. But if we do nothing, all of that bacteria, every time the pet chews, that bacteria in the mouth is getting into the bloodstream and causes slow changes to the heart, liver, kidneys, lungs, and brain. So we know from people that a healthy mouth is equals a healthy body. So that's why we're so proactive about recommending cleanings every 3 to 6 months for people, because we know that that can have a significant impact on keeping us healthy for longer because of the impacts it has on our organs. And kind of one of the newer things that we've been discussing is canine cognitive dysfunction.
Mm.
So I went to a lecture a few years ago with a neurologist that was talking about the impacts of dental disease on canine cognitive dysfunction, because we know from people and dogs now that when they get a urinary tract infection, that can significantly progress canine cognitive dysfunction and Alzheimer's in people. And
Yeah.
so infection in the mouth can do the same thing. So another great reason to stay
And
on
that's
top.
when owners are like, oh, they're too old for dental.
Yeah. Yeah,
Oh,
exactly. Yeah. Age is not a disease.
nope, it's not.
Another thing that people often don't think about that I do try to talk to my clients about is another risk of doing nothing is jaw fractures. People don't think about the fact that periodontal disease is infection of the bone, and we lose bone level around the teeth, and it can get so severe, all of that inflammation can eat away at so much bone that we don't have much bone left. And this is a pug. This is a pug I saw a number of years ago, and he fell off the bed and bumped his nose, and he broke his jaw because he had such severe dental disease of this tooth that it didn't take much pressure or force to fracture his jaw.
Mm.
And we even see, especially like Chihuahuas that don't have much bone already in their jaw, the infection has gotten so bad in their incisors and canine teeth that they're half of their mandible is missing because it's just been eaten away by dental disease. So that's a big risk people don't think about. So what can we do? This is Shannon, our previous CSR, and she's very frustrated about dental disease and wants to do something about it. So that's what we're going to talk about now. So number one thing you can do is home care. So we'll talk about options for home care and you know, what might work for you. Number two, avoid foods with high sugar content to avoid cavities. Number three, bend and press rule for chew toys. So there's certainly some chew toys that we recommend and others that we don't. So we'll talk about that. And then the number four thing is regular COHAT, so comprehensive oral health assessment and treatments to, you know, get rid of the biofilm and plaque in the mouth, get underneath that gum line with cleaning so that it does not progress into later stages of dental disease that we cannot reverse. Okay, so dental home care. We generally stick with things recommended by the Veterinary Oral Health Council. So this is a council that tests and approves different products for pets and says whether or not they work. So there's kind of three categories here for home care. There's daily brushing, which is the number one best thing you can do. There's dental diet or treats, so chewies and diets, and then there's oral health rinses. And this is kind of the order of how I think they work. So daily brushing is the number one best thing you can do. Second best thing is daily dental diet or treats. And then the third best thing would be oral health rinses. And you can certainly do a combination of all of these things too, if you have a pet that's significantly prone to dental disease. We'll talk about each of these. So number one, daily brushing. It is certainly something that not everybody's capable of doing, depending on the pet. Some may not tolerate it, but it is something that you can train. So it's not, I wouldn't recommend on every pet that you just start brushing and expect them to sit there for 2 minutes of brushing right from the start. So there are ways to train them, certainly making sure you find something that's very rewarding for them, that rewards them for allowing you to brush, and working your way up from just licking the toothpaste off the brush to, 1 or 2 minutes of brushing every day. And there's a brushing tutorial on our website. If you go to mainlyvetdentistry.com, there's a video, and I believe there's an article as well on how to introduce brushing to your pet. Next best thing is chews. So if you go to the Veterinary Oral Health Council website, vohc.org, there is a list of products that they certify and recommend. For cats, there's Greenies and Purina Crunchy Bites are a couple of the oral chewies, as well as Hill's TD or Purina Dental Diet as well, or full balanced diets. And then for dogs, Greenies are also approved. We really like Oravet chews. Oravet chews have a like a waxy substance on the surface of it that helps coat the teeth in a waxy substance to prevent plaque from sticking. We also use the Oravet sealant after we clean teeth at our practice to try to keep tartar down, especially for those pets that had oral surgery and we can't brush for a couple weeks, we can't do chews for a couple weeks, so we apply that Oravet sealant to try to prevent a lot of plaque and tartar from sticking during that 2 weeks of healing time. And then third best thing for home care, like I said, was water additives or oral rinses. So Healthy Mouth is one of those products. So unfortunately, they were impacted by the fires in California. So Healthy Mouth, I think, is very hard to get a hold of right now. Vetrident also has a approved for dogs. The Veterinary Oral Health Council has approved it for dogs. Unfortunately, I don't think they've gotten approval for cats yet, but Vetrident water additive is certainly another option. With Healthy Mouth, you can add it to the water, but you can also add it to the food if they won't drink it in the water. So that's another option. Okay, so number two thing you can do at home to prevent periodontal disease or cavities in this case is avoid foods with high sugar content or that are too hard for the teeth. So believe it or not, ice cubes can certainly fracture teeth, especially for our little dogs that might have smaller teeth that are more fragile. But then sugar content, ice cream, bananas, sweet potatoes, even carrots at a high volume. We've seen cavities really commonly in pets that have homemade diets, and part of their homemade diet is sweet potatoes. So they're getting sweet potatoes every single day, and that definitely can increase the risk for caries lesions. Number three, proper chew toys. So unfortunately, there's a lot of misinformation out there that antlers and marrow bones and Himalayan yak cheese are really great for teeth because they remove plaque and tartar. The problem is that they also remove enamel because they're very hard. So chewing on these things comes with a very high risk of your pet fracturing a tooth, especially the fourth premolar, the big carnasial on the upper back part of the mouth, because that's the tooth they chew with the most. So we see a very, very common thing that we treat is fractured upper fourth premolars. And once the tooth is fractured, the pulp or dentin is exposed, the tooth eventually gets infected. And so that tooth, once it's fractured, either needs, if the pulp is exposed, so the center of the tooth either needs to be extracted or have a root canal, because there's a blood vessel and a nerve in there. The tooth initially is very, very painful when it first gets fractured. The nerve regresses after a little bit of time, so the pain mostly, other than some significant sensitivity, a lot of the pain goes away for a short period of time, but then infection travels down the tooth and we get a tooth root abscess, and then the tooth becomes very, very painful again. So if there's pulp exposure, the tooth either needs a root canal or extraction. If the dentin is exposed, so the enamel's missing, but the pulp is not exposed, so the dentin is the middle layer of the tooth, or the second layer of the tooth. If x-rays are okay and the tooth has not become infected yet, we can place a bonded sealant on those to cover up the dentin and seal the tooth so that hopefully it doesn't get infected. But either way, fractured teeth have to get treated. So that kind of removes the benefit of these harder chews removing plaque and tartar, because they remove enamel too. And then number 4, regular cohats with dental x-rays. So as we talked about with people, even though we brush our teeth 2 or 3 times a day, and generally we can do a very thorough job in our own mouths, probably much more thorough than we can on our pets, we still go get our teeth cleaned every 3 to 6 months, depending on your risk and if you have dental disease or not. We go get our teeth cleaned. And the most important part of that cleaning is cleaning underneath the gum line, which, the brush does a little bit, but not as well as we can professionally. And we see many, many pets that have minimal, hardly any plaque or tartar on their teeth, but have significant periodontal disease, because it's the bacterial change that causes the inflammatory response. So we can have minimal plaque and tartar and still have significant dental disease. So it's a huge benefit to doing these regular cleanings under anesthesia. Yes, pets have to be under anesthesia because we can't clean their teeth awake properly underneath the gum line, nor can we do x-rays to see what's going on underneath the gum line. So huge benefits to cleaning their teeth under anesthesia before we see problems. If we wait until we see significant dental disease to do a cleaning, it's too late. Now we're extracting teeth to get rid of the infection. So just getting on a regular schedule for little dogs, that's starting at 18 months. If it's a Yorkie, maybe arguably 12 months of age, their first cleaning. And then every 6 to 12 months, depending on the breed and their risk for dental disease. So larger breeds in general don't have as high of a risk for dental disease, so we can space their cleanings out a bit more. And then little dogs like Chihuahuas and Yorkies and Shih Tzus and even bigger brachycephalic dogs, so dogs with the smush face, they need cleanings more regularly to prevent dental disease. So I always like to touch base on anesthesia, because that's usually one of the biggest reasons why people don't do regular dentistry on their pets, because they're worried about the risk of anesthesia. And the risk is never zero. There's always risk when it comes to anesthesia, but it can be kept quite low if it's done properly. So this is our monitoring system. This is the standard of care for anesthesia as far as monitoring all the parameters. So we monitor their heart rate, their rhythm, so their ECG, their oxygen levels, their CO2 levels, their temperature, their blood pressure. And, if we monitor them thoroughly, we can keep the risk very, very low, as well as we keep them a little bit lighter under anesthesia than we would for, say, a bigger surgery. So if we're doing an abdominal surgery, they're going to have their abdomen open on the table. we have to keep them, a little deeper because we don't want them to wake up. But with dentistry, if they wake up a little bit, it's not as tragic, as detrimental, because they don't have an open abdomen. So we keep them a little lighter. We have a technician dedicated to monitoring them and also ensuring we're keeping them on that lighter plane of anesthesia. And we use nerve blocks, just like human dentists, to block any feeling in the mouth when we do oral surgery so that we can continue to keep them lighter because they can't feel what we're doing. So a lot of things we can do to keep anesthesia safe, and the risk of untreated dental disease, because we talked earlier about how that impacts dental disease impacts all the organs in the body. The risk of that is, in my opinion, much, much higher than the risk of anesthesia when it's done properly.
Do you do blood work?
Yes. So everybody has to have blood work within the last 6 months, depending on the patient. If they have chronic health conditions, or their blood work wasn't normal, we might want blood work more recent. But for healthy pets, if they have blood work in the last 6 months and nothing's changed in those 6 months, we don't repeat it. But we definitely require blood work because we need to have a healthy liver and kidneys to process anesthesia.
Perfect.
And we do, for younger pets, healthy pets, under the age of 8, we do a smaller blood panel. For patients over the age of 8, we do a senior panel, including a pro-BNP to check to make sure their heart is okay for anesthesia.
Perfect.
So a little more thorough blood work just to keep them safe. But as we talked about earlier, age is not a disease. So but age certainly does increase the risk that they could have disease. So we are more thorough with our blood work to make sure they're healthy. But as long as blood work looks good and their heart is okay, then, risk of anesthesia is still low. And certain diseases don't necessarily preclude them from anesthesia. There's ways that we can manage some diseases. So if we've got kidney disease that's managed or heart disease that's managed, that might increase our risk a little bit. But if it's only a little bit, treating the dental disease in their mouth is certainly going to help with those chronic conditions as well, because all that bacteria is not good for the heart and kidneys either. So we work with an anesthesiologist if people are willing to do that. We have a remote anesthesiologist that will do consults for us for those patients with chronic diseases that might need a little bit more intensive management under anesthesia.
Cool.
Yeah. All right, that's it. So we love teeth. This is what we do. It's our passion. We love to help with anything teeth related. So don't hesitate to ask questions. Our email is here, and our website has a ton of great information, but in our social media sites also, we're really active on there. We post a lot of great information to keep people up to date on this problem in their pets.